Hello and welcome to this Vibrant publication summary video. Today we'll be talking about this study called Association of APOE polymorphisms with Serological Lipid and Inflammatory Markers. Let's get started. Did you know that a single genetic variant can change how your body processes cholesterol and even influence your risk for heart disease or Alzheimer's disease? One of the most studied genes in this area is apolipoprotein E, or APOE for short. Variations in this gene don't just affect cholesterol, they also drive inflammation, one of the biggest contributors to chronic disease worldwide. That's why Vibrant scientists conducted a large study to better understand how APOE genotypes shape blood lipid and inflammatory profiles, and what this means for cardiovascular and brain health. This peer-reviewed study, published in Cureus, in May 2024, included 915 de-identified samples tested at Vibrant America Clinical Laboratory. The goal was to assess how different APOE genotypes impact blood lipid levels and inflammation markers that predict cardiovascular disease and Alzheimer's disease risk. The researchers performed APOE genotyping using polymerase chain reaction and measured 12 lipid biomarkers, including LDL cholesterol, the bad cholesterol, HDL cholesterol, the quote good cholesterol, along with triglycerides APOA and ApoB, as well as 4 inflammatory markers, including high-sensitivity C-reactive protein, hsCRP, and myeloperoxidase, also known as MPO. Then, they compared the 6 major genotypes, including E2-E3, E3-E4, and E4-E4, against the most common baseline genotype, which is E3-E3. Real-time polymerase chain reaction, commonly called RT-PCR, is the gold standard for accurate genotype identification. Briefly, DNA is extracted and purified from samples. Then, genes are paired with known complementary sequences called primers to identify which genotype is present, like APOE33 in this example. Primers are small fragments of single-stranded DNA designed to bind specifically to a single region in the genome, allowing precise amplification of the diagnostic target area. Then, probes are used to quantify the amount of each genotype. Probes bind to the target area and give off a fluorescent signal as amplification of that area increases. This fluorescent signal is then read by a quantitative real-time PCR machine, where the reaction occurs to give a quantitative readout. The results of the study were striking. E2 carriers like E2-E3 had higher HDL and APOA levels, suggesting a protective effect. But they also had higher triglycerides and hsCRP, showing that risk is complex. E3-E4 carriers showed elevated cholesterol, LDL, Lp(a), oxidized LDL, and ApoB, a profile strongly linked with atherosclerosis and inflammation. And E4-E4 carriers, the highest risk group, had the most abnormal profiles, specifically high LDL, ApoB, Lp(a), oxidized LDL, and inflammatory markers like MPO and hsCRP. In short, E2 alleles lean towards protective, while E4 alleles strongly predispose to cardiovascular disease and Alzheimer's disease risk. This study also introduced novel findings such as the association of APOE genotypes with markers like plaque, PLAC, and the ApoB to ApoA ratios, both of which are indicators of plaque formation and vascular risk. Why does this matter? Because APOE genotyping, combined with blood biomarker testing, can provide an early warning system for individuals at high risk of cardiovascular and neurodegenerative diseases. For clinicians, knowing a patient's APOE genotype helps identify who may benefit from more aggressive dietary and lifestyle interventions. Also, pinpoint patients who may need closer monitoring of LDL, ApoB, and inflammatory markers, as well as personalized recommendations like a Mediterranean diet, omega-3 support, or anti-inflammatory strategies, all based on genetic risk. At Vibrant, this research isn't just academic, it translates directly into clinical practice. APOE genotyping is part of Vibrant's Cardiogenetics test. Cardiogenetics evaluates key genetic variants involved in cholesterol metabolism, blood pressure regulation, inflammation, blood clotting, and drug response, providing actionable precision medicine insights for personalized prevention, early intervention, and lifelong heart health. Cardiogenetics can be bundled synergistically with the CardioZoomer to provide a comprehensive view of cardiometabolic health by measuring both traditional and emerging biomarkers across key risk categories. By ordering Cardiogenetics and CardioZoomer together, clinicians can integrate genetics, labs, and lifestyle recommendations into patient care. And this is how vibrant research fuels vibrant solutions. To recap, this vibrant study of over 900 patients showed that APOE genotype profoundly shapes lipid and inflammatory profiles. In general, E2 alleles are relatively protective, while E4 alleles drive higher cholesterol, LDL, ApoB, and inflammatory markers, translating to greater cardiovascular disease and Alzheimer's disease risk. And early genetic testing enables proactive and personalized intervention. If you're a provider, you can bring this research to life in your own practice. Explore Vibrant's advanced CardioZoomer and Cardiogenetics tests to help patients understand their risk and take action early. If you're a patient, let your provider know you're interested in Vibrant's Cardiogenetics and CardioZoomer tests. And if you'd like to read the full publication, check out the link in the video description to access this study in Cureus. To learn more, check out the video description. If you have any questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.